essentially, you can see that there are a lot of brain areas, and that the PD affects some very important areas that control eye movement. So again, brain and eyes work together. The eyes move to put the fovea, or the center of the retina, in the right view, in straight line to whatever it is you're looking at. And then the eyes are held still, connects, information goes to the brain, and the brain goes, ah, yes, that's a butterfly. Okay, so to summarize some things real quick, we are studying eye movement at Stanford, looking at a variety of different things with these non-invasive eye trackers. And so when the patients come in, we do our usual clinical assessment, and we may do an eye movement recording. So that's an example on the left upper corner of a patient who's actually trying to hold their eyes still. Okay, they're looking at a single dot, and that's a kind of deviations and oscillations some people have. So you could imagine how helpful it is to do a recording. So when we treat the patients, we may actually take a look to see, well, did the treatment make the eye movements better, worse, or no change? And we often do imaging studies, or help us think about, well, what's really happening here in terms of the neural network and what happened in this particular patient. So I mentioned a word before called saccades. These are the fast eye movements that help you scan a room. So this is just a picture of what you may be doing, not even thinking about it, but as you're listening to me talk, you're actually looking at the pictures in the front, looking at other things. So this is something that you're doing right now. And the other thing that's useful, you actually use it to read. So I'll just show you, this is a video of what it might look like for someone who has normal eye movement to be reading. So you're making saccades from left to right, and then from top to bottom. And this is what you do over and over again to read. So if you have difficulty seeing, then you may pause for longer at each word. You may actually backtrack and check, well, what was it that I just read? And so if we take someone who has PD, then this might be quite a bit slower, and they may not even make it to the whole 4 lines within the time that they were given. Another thing that I wanted to illustrate is just looking at a painting. And I don't know if people in the back can see, but this is a painting by Velázquez called Las Meninas. And there are lots of different things in the foreground and in the background. And so people tend to start in the center. So the girl tends to get the most amount of attention. And then you're looking at edges, you're looking at the man in the back. And people often, at the end, find the dog in the foreground on the bottom. And so we could make these studies and then generate sort of a attention map or a heat map. And people have actually used this to study attention and designing advertisements, and Google has used it. So this is actually something not only you do, but the other people who are trying to get your attention, they try to design things a certain way. Okay, so coordination of the eye and brain. So this is an example of what you have to do while you're driving to coordinate all of that. And for someone with PD, it may feel sort of like this, where the world or the information is either not very clear or coming a little bit too fast. So that's actually part 2. So I'd be happy to take questions about just normal visions after the teaching points. So number 1, the eyes move to put the target on the retina. And then the visual pathway is very long. It goes from the eye all the way to the back of the brain. And the 2 eyes need to line up in order to see one image. So when they don't line up is when you get double vision. All right, questions? In the back.
What do you know about Parkinson's?
He's wondering, in the middle of the night, sometimes he sees just these spots. Yeah, in only the left eye. So I've actually, I could give a whole lecture on that, and I have actually teaching our residents. So visual hallucinations are common in PD, but they're also common in other conditions. So when you don't see well, sometimes the brain isn't getting the right information in, so it makes up signals on its own. So it could be from anywhere from the retina to the back of the brain. So that's something that's actually very, very common. And so visual hallucinations are present probably in something like 25% of patients with PD, but it's not necessarily related to PD.
To what degree are the medications that we take impact our vision?
So I would say a little. So dopamine agonist or Cinemet has been actually well recognized to improve vision, but that improvement is transient. So it's not thought to help. So in fact, I personally have had patients who say that. Essentially, like I mentioned before, there are dopamine neurons in the retina. And so people have looked into this both in patients and animal models, but the bottom line is the medicines don't particularly help your vision, at least with dopamine supplementation. The eye movement control can be better with these medications, but they're not thought to improve in very dramatic ways. So there are other medications that we typically would prescribe. For example, Namenda or amantadine, which is sometimes prescribed in PD, that actually has a effect in terms of helping you control the eye movement a little bit better. But this is an area that really lacks good, effective medications. So the short answer to your question is the medicines you take have sort of minimal and maybe transient benefits in terms of vision.
I don't know if this is an appropriate time to ask about cataracts.
Right, so the question is, would cataract surgery improve your vision a lot or not at all? So your example of your husband was it helped briefly, but not very much after maybe a week or so. So essentially, the cataract surgery, all it does is it takes the cataract out. So if your trouble with vision is from cataract, then it should be very effective. And people have restored vision to 2020 or even 2015 after cataract surgery. However, you can't say that it's not because of something. Like for example, they have to put a lens. They implant a lens in there after the cataract surgery. Well, if the lens wasn't calculated perfectly, you could have blurry vision from that. So assuming it's related to the cataract surgery, if everything goes well and it's a routine procedure, it should help a lot. But if it's not from cataract, then that's not going to help at all. So it's not unusual for patients with PD to have glaucoma, for example, or for other things. So just because you have PD, you're still allowed to have all these other things go wrong with your eyes. And so if it's from macular degeneration, then it's not going to help. But I would guess that his vision may be at least slightly better if the cataract was actually quite dense before the surgery. It is better.
It is better.
Yeah, just not miraculous. Better. Yeah, so I mean that would be an example of something that's relatively easy to do to improve your vision, assuming it's related to the cataract. So that's a really good question because we all get cataracts. It's just a matter of time. So you should all be wearing sunglasses to protect your eyes to reduce the free radical damage. And essentially, if you take care of yourself, hat's a good idea. So if you take care of your eyes, then you're more likely to, or control the diabetes or other things. You're more likely to have good vision for as long as possible. All right. Any other questions?
You were talking about spots earlier. Is that the same as floaters?
Different. So
okay.
Floaters are not the same as hallucination. So floater is an actual little piece of something inside the eyeball. And it floats around. That's why people call them floaters. And they actually never go away. It's sort of like they settle and they move around. And when you don't see them, they're still there. They might just be, because when you're lying down, they sort of settle in a different position. And then when you get up, they settle downwards. So you might see your floaters the most in the morning when you wake up and you're looking at a blank wall. That's relatively bright. So floaters are based on some kind of real thing there, whereas hallucinations are completely not based on anything. They're just there. So yeah, different floater versus hallucinations. Question in the back. Well, the bottom line is you're doing them all the time. If there's certain exercise that seem to work for you, I would continue. But typically, a lot of people don't like having these regimented, relatively simple exercises, because you're already doing them. And the eye movement, there are different kinds. So there are the fast eye movements, which I emphasize. Those are actually more important for your function. So there's also the smooth eye movements, the tracking. Like if you see an airplane in the sky and you watch it fly across the horizon. So the tracking is also affected in PD. And that's actually functionally not as bad as if you have your fast eye movements affected. So essentially, you could do exercises that if they feel like they help you and they don't cost you a lot of money, I'm all for it. But otherwise, you'd be better off doing puzzles, video games, and stuff like that. That's sort of fun and also mentally interesting.